Today features results from a randomized phase 2 trial of a first-in-class antibody in combination with chemotherapy as treatment for advanced gastric cancers. Lead author, Dr. Salah-Eddin Al-Batran, a medical oncologist and director at the Institute of Clinical Cancer Research, Nordwest Hospital in Frankfurt am Main, Germany, will present the study.
Thank you very much. Ladies and gentlemen, colleagues, members, thank you very much also for this opportunity to present the results of this interesting study to you here. As mentioned, this was a phase 2 randomized international multicenter trial of chemotherapy, EOX chemotherapy, with or without IMAB 362, a first-in-class anti-Claudin 18.2 antibody in the first-line treatment of patients with metastatic gastric or gastroesophageal junction adenocarcinoma. So the IMAB 362 antibody is a chimeric IgG1 backbone antibody which is highly specific for the Claudin 18.2. Claudin 18.2 is a component of the tight junction proteins. The tight junction proteins are very important structures for cell adhesion, integrity, and many other cell and tissue-specific functions. So this antibody, once it targets the Claudin 18.2, it acts in different ways, including antibody-dependent cellular cytotoxicity, ADCC, and complement-dependent cytotoxicity, CDC, but also in combination with chemotherapy over immunomodulation of tumor microenvironment. So the antibody is a classical immune therapy. In this trial, we screened 730 patients for their Claudin 18.2 expression, and 686 were accessible. Of those patients, about half of them had Claudin negative expression, or the expression was too low to be eligible for the trial. So the expression rate is about 50% in the trial. Few other patients were excluded for other reasons. So 252 patients were eligible and were randomized into 3 arms. Arm 1, EOX chemotherapy. Arm 2, EOX chemotherapy combined with IMAB 362 at 600 milligram per meter square every 3 weeks with a loading dose of 800 milligram per meter square. Later, about 1 year later, we introduced a new third arm, which was an exploratory arm aiming at the evaluation of the feasibility and activity of a higher dose of IMAB, which was 1,000 milligram per meter square every 3 weeks. And this arm will not represent the focus of this presentation because the results came after the abstract was submitted to ASCO. The primary endpoint, Arm 1 versus Arm 2, was progression-free survival at a hazard ratio of 0.725, an alpha of 10%, one-sided, and a power of 70%. The patients were stratified according to Claudin positivity and measurability of disease. Main inclusion criteria included the disease, gastric, esophageal, or junctional adenocarcinoma. All patients had to be first-line patients, and locally advanced or metastatic disease were eligible. And most importantly, patients had to have a 2+ or 3+ expression of Claudin 18.2 in immunohistochemistry and equal or more than 40% of the tumor cells as evaluated centrally with a validated CE-marked IVD kit. Patients had to have an ECOG performance status of 0 or 1. These are the main results of the trial. The progression-free survival, which was the primary endpoint, median progression-free survival was 4.8 months with EOX, and 7.9 months with EOX plus IMAB. The hazard ratio was 0.47, and the p-value was 0.0001. With this, the study met its primary endpoint with a clearly significant improvement in progression-free survival. Also, overall survival improved significantly. Median overall survival was 8.4 months with EOX and 13.2 months with EOX plus IMAB 362. And according to a hazard ratio of 0.51 and a highly significant p-value of 0.0001. You see the curves separated early, and they maintained the separation also in the later course of the development. We also looked at the progression-free and overall survival in the so-called high expressors. These were patients who had a Claudin 18.2 staining in 70% of their tumor cells, or more than 70%, and both progression-free and overall survival were pronounced, or the improvement was pronounced in this cohort. Median PFS was 5.6 versus 7.2 months, according to a hazard ratio of 0.36. And median overall survival was 9 months with EOX and 16.7 months with the EOX plus IMAB 362, according to a hazard ratio of 0.45. So it seemed that patients who expressed more Claudin derived more benefit from the treatment. These are the objective response rates according to RECIST. The overall response rate was 25% with EOX and 39% with EOX plus IMAB, with a complete response rate of 3.6 versus 10.4%, and a partial response rate of 21 versus 29%. In terms of toxicities, the treatment was well tolerated, with most of the side effects being one-digit numbers in terms of the grade 3/4 toxicity. What we saw that there was a slight increase in the rate of grade 3/4 neutropenia from 21.4 to 32.5%. And what we also saw is an increase in grade 1-2 and in grade 3 and vomiting. As you see here, grade 3 for vomiting was slightly increased from 3.6 to 10.4%, and also grade 1-2 from 34.5 to 55.8%, which could be a specific side effect of this antibody because tight junction proteins and Claudin is present in the gastric mucosa. So in summary, the FAST trial clearly met its primary endpoint. There is a significant improvement of PFS and OS in the entire cohort, but also in the more pronounced in the higher expressors. IMAB and EOX was feasible and well tolerated, and this study provides a strong rationale for a confirmatory phase 3 trial. I would like to thank all patients and their relatives who participated at this trial, all investigators and study teams, the colleagues and scientists who invested years of work in this antibody, highlighting Özlem Turici, which is here with us, Ogor Shahin and Christoph Huber. And thank you very much.
Thank you, Dr. Al-Batran. This is an important study documenting activity of a first-in-class antibody in patients with advanced gastric and GE junction cancers. The target, Claudin 18.2, is expressed in approximately 50% of cancers, so suggesting this treatment could apply to many patients.